Hi, and welcome to Class 4. We are going to talk about metabolism and weight control in this module. So we've talked before about energy, and really what energy is energy allows a body to perform work or activity of some sort. Energy helps produce change. It's needed to maintain life. We have a form of energy called chemical energy, and that is actually stored in foods. And so when you consume foods, that chemical energy is converted to mechanical energy when you eat it. And it's used by the human body as an energy source. So we need to consume food in order to have energy for our body to be active. Energy is measured in calories, which we've also mentioned before, and the energy that's released from food is measured in kilocalories or calories. The calorie is, what really a calorie is the amount of energy that's required to increase the temperature of water by 1 degree Celsius. That's the technical term of what a calorie is. So when nutrients are released from food, they release energy when they're catabolized or they're broken down. That catabolism produces carbon dioxide and water, which gets caught up with the adenosine triphosphate or the ATP. And what ATP is, it's that fuel for all energy requiring processes of the body. So you need to have ATP in order to have energy processed throughout your body. So how we get energy, as you remember back to the other lectures, we've talked about the amount of calories that are assigned to carbs, fats, proteins, and alcohol. Well, those are our energy sources with the exception of alcohol. So carbs, fats, and proteins are kind of the order in which energy is used. And we're going to talk about that sparing. So the third line of energy source is protein, and that is protein is spared. We call it a protein sparing effect. Protein spared, when there's enough carbohydrates present, you don't need to use protein for energy. So when these foods are ingested and broke down, carbs metabolize down to glucose, fats go to fatty acids and glycerol for energy, and protein goes to amino acids that your body uses for energy. So as carbs is an energy source, because it digests down to glucose, the technical process of that is called glycolysis, where the glucose is converted to pyruvic acid for energy through the process of glycolysis. And glycolysis in itself is what's called an anaerobic process. So that means it does not require oxygen in order to provide energy. So with the process of anaerobic glycolysis, it allows us to have a quick energy source for very short bursts of activity. Because it doesn't require oxygen, you're not able to do it for a very long period of time. So maybe an activity like, jumping up and running to the phone, really short period, a quick sprint. It's a limited energy source. And it provides related to a lack of oxygen, so very limited. So what happens during this anaerobic process is the lactic acid builds up in the muscles, your muscles get sore, and then you have to stop the activity, which is why it's only good for short periods of time. So after that anaerobic process, we have an aerobic pathway or aerobic glycolysis. And what happens during that is you have pyruvic acid that reacts with what's called a coenzyme A. And that coenzyme creates acetyl coenzyme A for longer acting energy sources. So it's a primary energy source for activities that are longer than 5 minutes. So if you're looking to differentiate them, shorter than 5 minutes is your anaerobic, longer than 5 minutes is your aerobic. So things that are longer, like going for long walks, a long run, biking, swimming, things like that. Now, aerobic activities are really good because what that does is it facilitates muscle growth. So now we talked about carbs as being your first source of energy. And if carbs are not available, then your body will go to fat and protein as energy source. So fat is the next reserve. So the fats, what happens with that, how it provides energy, is the fats will break down stored triglycerides into glycerol and 3 fatty acids. That glycerol is then converted to pyruvic acid and used by the body for energy. Now, if you don't have carbs and you don't have fat, then the very last reserve is protein. And you don't want to get to that point. So protein, what happens is it's converted to amino acids. And some of the amino acids are converted to pyruvate for energy and used by the body. So that process is actually called gluconeogenesis. So pyruvate is converted to glucose, and then fat and protein then become usable as energy sources. So there's some terms that will help you kind of understand this process a little bit. And we talk about, if we mention lysis, that means splitting, and genesis is a creation. So if you have glycolysis, that's a splitting of glucose into energy. And glycogenolysis is a splitting of glycogen into energy, and glyconeogenesis is create glucose from a non-carbohydrate source. So here's kind of your process here of how that occurs. I also have this video posted in the course, and it really does a nice job of, describing glycolysis and glyconeogenesis. So take some time to review that, because it is a very technical process. And if you haven't had microbiology, that might be something you want to review. So we look at energy balance. So what energy balance, when we talk about that, we look at healthy weight maintenance. So the best way to maintain a healthy weight is to only consume the amount of energy or calories as we expend. It's because what comes in goes out, and you don't have weight gain that way. So a person who has a sedentary lifestyle doesn't need as many energy because they're not burning the calories. So somebody who, doesn't like to do a lot of activity, or self-proclaimed like couch potatoes, they don't need to take in as much energy. Now, athletes, on the other hand, they expend a lot more energy. So their energy intake really must meet their own individualized needs, because based on their activity level and how many calories they're burning. Now, there's some other unique situations based on what people's medical issues are. So patients who are acutely ill and have chronic disease, based on what's going on with them, they have very individualized needs for energy based on their problems. Burn patients or patients who have cardiac disease, things like that. That's where you're going to have your intercollaboration with your dietitian, and they're going to look at developing individualized plans and meal plans for these patients in order to promote wellness. So what happens if we take in an excess amount of energy? So if we take in an excess amount of carbs, that glucose, carbs breaks down to glucose, so that glucose that's not needed is converted to glycogen, and it's stored in the liver and the muscle. We can only store a limited amount of glycogen, and the energy not used is converted to fatty acids and triglycerides and stored as body fat. So your body takes what it needs, stores limited amount of glycogen, and then the rest of it gets stored as fatty acids and body fat. Now with fat, the excess is recombined with the glycerol, and that is formed to triglycerides and stored as fat. So if you're taking in excess fat and you're not expending the energy, then it's going to be stored as more fat in your body, which can cause weight gain. Now proteins, if you have an excess of the amino acids, those are converted to fatty acids, and they're also stored in the body as fat, or also referred to as adipose tissue. And your kidneys will break down the ammonia from that protein catabolism and excrete what you don't need from the kidneys. So you've probably heard terms like basal metabolism or basal metabolic rate. We all talk about our metabolism. So what basal metabolism is, it's the minimum amount of energy that's required to maintain life-sustaining activities. So you just doing things like breathing, your heartbeat, hormone secretions, and circulation in your body requires energy in order to do that. So that's that minimum amount of energy that you need just to keep you alive. Now, the basal metabolic rate is the rate at how you spend the energy to keep those life-sustaining processes going. So how fast do you use that? So there's a lot of things that will affect the basal metabolic rate. So things like your body size, male versus female, if you're fasting or in starvation mode, if you've got a lot of stress, your thyroid function can affect that. How much lean tissue that you have in your body, how old you are. The older we get, our basal metabolic rate changes. So the BMR will vary with the amount of lean tissue that you have in the body. So men will have higher basal metabolic rates related to women due to the increase in lean body tissue. Now, after the age of 35, when lean body tissue decreases with the aging process, that will affect your BMR. The one way you can help kind of slow this process down and increase your BMR is to maintain fitness. So by being physically fit and active, that will slow the loss of lean body tissue. So with that being said, it's never too late to start exercising. You can kind of fight off this process a little bit through physical activity. That's why physical activity has so many different health-related benefits. So when we look at our resting energy expenditure, or also referred to as REE, that resting energy expenditure is the energy a person expends in a normal life situation while at rest. So how much energy are you using just while at rest? And that includes some energy the body uses following meals because it requires energy to digest the meals. It also has and takes into consideration some of the exercise. It does account for 60 to 70% of total energy needs. Now, building your muscle mass will also increase your resting energy expenditure. So being physically fit is a good thing. Your body size will affect it. So somebody who is heavier will use more energy to perform a task than a lighter person. So somebody who is physically fit, getting off the couch, walking to pick up the telephone or change the TV channel or use the restroom won't use as much energy as somebody who is morbidly obese. It's going to take more energy for them to get up off the couch versus somebody who's physically fit. I have a link here if you'd like to click on that in the PowerPoint presentation and look at the calculating your resting energy expenditure related to your own specific body needs. There is a nice video also posted in the course regarding basal metabolism that you might want to view to help give you a better understanding of this process. Now, we've talked about protein as an energy source. So if you think about a lot of these people who are in third world countries or on starvation related to lack of food, there is a significant effect on your body during starvation. So what happens is your body attempts to maintain that homeostasis. Your body likes to remain even keel. It doesn't like things off kilter. So when we talk about a couple terms, we talk about starvation. And what starvation is, it's an involuntarily going without food. So somebody doesn't have the means to obtain food, they're poor, there's a lack of food supply in where they live. Where fasting is voluntarily going without food. So people fast for lots of different reasons. They may fast for religious reasons. They may fast for certain diets. They may fast for, surgeries or maybe medical conditions, those type of things. So it's important to kind of understand how that affects the body. So starvation and fasting, basically both go without food, but one's voluntary, one's involuntary. So whatever the reason you are going without food, it doesn't matter. Your body reacts the same way. So when the intake of food is below metabolic rate needs, the body extracts stored carbs first, fat, and protein from muscles and organs in order to meet the energy needs. So it's kind of that order of hierarchy. Carbs, no more carbs, breaks down fat for energy. No more fat, it breaks down protein from your muscles. So if you think about that, if you're breaking protein from your muscles, what type of things are you going to have happen with your body? What would you expect to see? Well, let's talk about some things there. So as we know, we use that glycogen first, and that usually is depleted within 24 hours. So once that's depleted, we use the lipid or the fat stores, and that's your second energy source when the glycogen levels are decreased, and then protein as that third, right? So it extracts those amino acids from the muscles. So you would expect if you're pulling energy from those muscles, you're probably going to have some muscle wasting and weakness. We always use what's consumed first before stored. So if you're having adequate intake, you're going to use that energy first versus what is stored. So when your body is in starvation mode, your metabolic rate will slow down because you need to conserve that energy for those vital organ functions. It uses any stored carbs, then it uses fat, and then the ketones from the fatty acids will provide energy and decrease glucose needs in the body. So you need glucose for your brain function. So it tries to pull from whatever reserves it has to maintain some homeostasis. Now, protein will provide energy from muscle tissue, and that will cause muscle wasting and organ shrinkage. So if you have muscle wasting, you're going to be weaker. You're not going to have the stamina that you would have had you been eating or having a normal diet. So as the metabolic rate decreases, your body temperature will drop, your activity level will drop, you sleep more because your body's trying to preserve that energy for those vital organ functions. You have loss of intercostal muscles for respiration, so your breathing is slowed, may not be as deep as it would have been before. So you can kind of look here. These are a picture of a child who was in starvation and then was nursed back to health. So you can see, that child doesn't have the energy to even hold their head up. The child, you can see the loss here, the very thin extremities, the loss of those intercostal muscles. You can see the ribs. You can actually count their ribs. Versus here, he has more strength to hold his head up. His face is more filled out. So that has a big effect on the body. Now, we've all heard of fad diets. And chances are, probably at one point in your life, you may have even tried them or certainly have known somebody who has tried a fad diet. And so some things to know about fad diets are they reduce food intake and they produce immediate and significant depression in resting energy expenditure. By reducing the REE, it slows the rate of weight loss, and often any weight that is lost is regained. So they're really not a great thing. You may see some significant improvement right away, but then that weight loss goes right back on. So restricting calories shouldn't be less than 500 calories below your daily energy requirements. So looking at that REE calculator will help you figure that out a little bit better. So if your intake is less than 12 to 1500 calories, that does not provide enough nutrients for your body. So it's important that we provide adequate intake for our body to maintain energy, keep our basal metabolic rate up, and burn off activity levels to burn off the calories that we're intaking. So how do we do that? Well, there's a lot of health benefits of exercise that I talked about. It can reduce heart disease. It can decrease the rate of developing diabetes type 2, hypertension, high cholesterol, stroke risk. Has a lot of boosting your brain power. It helps with your mood. It releases a lot of serotonin in the brain. It's been described as one of the best antidepressant medications that are out there. It doesn't require meds. You can live longer. You sleep better. You have stronger muscles and bones because any activity on those bones will help strengthen those. So that's really good, especially for women and postmenopausal women. It relieves stress. It helps reduce your weight. And it builds muscle mass, which increases your body's resting energy expenditure and allows you to burn calories. Exercise builds that muscle mass. So some things to consider about exercise are to choose activities that are appropriate for the current fitness level. So if you were a couch potato, it's probably not going to be the best goal for you to say, I'm going to go out and run 5 miles on the first day. You need to have activities that are going to build you up. You may get to those 5 miles, but it might take you a little longer. So maybe you're going to go out and you're going to walk a half a mile, or you're going to be more active, and you're going to build up to that to build your stamina. It will increase over time, your activity. Make sure that you're under the care of a primary care, especially when you have chronic health conditions, to make sure that they are on the same page with your activity level. And exercise doesn't have to be strenuous to have health benefits. You'll see a lot of people, especially when you get into Nursing 141, when you're in the nursing home, they have a lot of physical activities, but people in wheelchairs are able to do them. So you see here, they're doing a lot of chair exercise with some resistance bands. So they can still have the health benefits without having to get up and think that you have to run a marathon. So with all of that being said, now we're going to talk a little bit about weight control. And I think a lot of us have all tried to do that, and that's our goal ultimately, to stay healthy and live longer lives. So let's talk about some things that we do that. If you're at a healthy weight, you feel physically more comfortable. Generally, people are more confident in their skin. You know, it's easier to do certain things, right? If you have a lot of belly weight, just bending over to tie your shoes is more difficult versus not having that in the way, you know. Focus on healthy eating and exercises. It's a lifestyle focus versus a diet. Most physicians and providers are going to tell you, we try to avoid diets. We try to just implement healthy changes in our life that we can maintain over long periods of time. You've all probably heard of body mass index, or BMI, and that is basically calculated by the ratio of weight to height. So it takes your weight in kilograms divided by your height in meters squared, and it gives you a number. So BMIs that are in those normal ranges to lower overweight categories are associated with less health risks. So looking up here, when you've got your BMI of like 18 to 24, 25, you have less health risk versus somebody is in the obesity, the high end of obesity, you're probably going to have a lot more problems, things like diabetes and hypertension and stroke risk and coronary artery disease because of carrying around that extra weight. Now, BMIs are not foolproof. They don't take a lot of things into consideration. It basically just takes the weight and height to estimate fat, and that's not always an accurate representation. So kind of look at these categories of BMI and become familiar with what is a normal range. Obviously, the higher the BMI, you have a higher correlation with disease risk. Being underweight also has issues with complications as well. So you want to kind of stay in that healthy weight range or that low end of the overweight, so that 25 end versus closer to the 30. You can take a minute here to look at the body mass index and that weight across the top, find your height, and then follow those down to where they meet and see where you fall as a body mass index. Now we talked about some of those BMI limitations, right? Well, BMI is a measure of weight, and it can't always tell us fat either. It's not a really great way to estimate how much fat. Some people have normal weight to height ratios but have higher levels of body fat than normal. So if you look here in the lower left-hand corner, you have 5 pounds of fat on the left and 5 pounds of muscle. So obviously the lean muscle is going to be healthier for you and decrease your risk of health disparities versus having 5 pounds of fat. And the person over on the right here, you can see in the midsection here, they're both the same weight at 155 pounds. The midsection has more adipose tissue versus this person who's worked out and built more lean muscle mass and burned off some of that fat. They didn't lose weight, but they certainly are more physically fit. So that BMI is always not a great thing. It just is that height and weight. So it's more of a tool. It doesn't take into consideration your bone mass at all. So some people are larger framed than other people. And bones weigh more. So that will affect your outlook as well. Now, we do need fat does have a function in our body. It does help protect us from temperature, so it insulates us, keeps us warmer. It cushions those internal organs, keeps them from being, when we're in those contact sports or when we're accidents or fall, it helps keep them protected. It is used as a good means of energy when it's stored in the body. If your body needs it, it's that second source of energy for your body. Now, I mentioned that not also being underweight can have problems. So people who are underweight, who have a BMI that's less than 18, can have things, especially women. They can have amenorrhea, or that means an absence of menstrual cycles. You can have organ problems with that, heart failure, your GI tract will change, your mentation will change, so your brain, hormonal changes in your body, cardiovascular, bone changes. So there's a lot of things that can happen with somebody who is also underweight. Now, also, the flip side of that, people who are overweight have a much higher risk of cancers like kidney, gallbladder, and colon. Metabolic diseases like cardiovascular disease, hypertension, high cholesterol, stroke, diabetes, insulin resistance, problems with birth defects or infertility. Maybe they're having a miscarriage or a stillbirth. I knew somebody who was extremely overweight and young girl, like 20s, and newly married and was pregnant, and she actually had a couple miscarriages because of her weight. She was not able to maintain that pregnancy. Asthma from respiratory issues, depression mentally, osteoarthritis because of that extra weight on those joints. Your joints really take a whipping there when you have extra weight on them. Sleep apnea, because a lot of times they tend to get really large necks, and so they'll have sleep apnea, which will shorten the lifespan as well. That's why I say that having higher BMIs are actually associated with more health disparities. So factors that can impact the chance of obesity, well, we look at obesogenic environments, and I think one of your discussion questions is going to talk about that. So things like what in your physical environment impacts your ability to have a healthy lifestyle. So things like technology. We do a lot of sitting at our jobs. We do a lot of being plugged in. We're tied to our cell phones, to our email, to our laptops, our iPads, our Apple Watches, all of those things that make you more sedentary. Now, also living in a high crime area. So people who have a lot of crime in their community don't tend to go outside because it's not safe to do so. So that tends to create obesogenic environments. A lot of schools have cut out recess because there's no time. They need to get all of those things in the curriculum in, so they're not having recess. Hormones can affect it. Individual energy efficiency affects it. So lots of different things. So with some diet treatments for obesity, there's a lot of different things that are out there. Obviously, we've talked about fad diets that just promise those large and rapid weight loss, usually not the great way to go. You also have very low calorie diets, which are 200 to 800 calories. Now, that's significantly lower than what people should be consuming. Well, if people are on those type of diets, that requires strict medical supervision. The weight is often regained as soon as you start going back to eating those extra calories. So yeah, you may get some weight loss initially, but it doesn't last for very long. Sometimes it is used with medical supervision when traditional methods have not worked. And the calories that they do give them are provided through very high biologic values, so high quality, nutrient dense. They're not going to give somebody 200 to 800 calories and allow them to have a Snickers bar as part of those calories. That's probably all they would be able to have for the whole day if that was the case. They have a lot of formulas out there, meal replacements, shakes, protein things. Those are about 900 calories a day. But again, often the weight is regained. A lot of medications that you can take. It's really controversial because of some of the side effects and abuse of those drugs. But sometimes they are used when other methods fail. And we do have a lot of people you're seeing now are having the bariatric surgery. So a moderate restriction of calories is where you reduce calories at least 500 calories less than what your energy requirement is. So if you are reducing what's required, then you're going to have weight loss. But you shouldn't really go between less than 1,200 calories a day unless you're under that medical supervision. So some things to know that in order to lose 1 pound of body fat a week, you need the daily energy expenditure has to increase by approximately 500. So you need to burn 500 more calories in order to lose 1 pound a week. So that's important to know as well. And surgery has that rapid weight loss, but it's not foolproof. How many people have you seen? Now, some have done very well, and some have had bariatric surgery, and I know several who initially lost a lot of weight, but then they've regained that and more. And along with that, it's non-reversible for a lot of these surgeries where they have absorption problems because of the change in the GI system that occurs with the surgery. They're not able to absorb a lot of these vitamins and minerals. And so along with that also comes other issues. So really having a wellness approach to weight management is the best thing. So establishing those realistic goals, change your behaviors, have a realistic time frame. Don't say I'm going to lose 50 pounds in a week because then you're going to fail, obviously. Very specific, not just say I'm going to lose weight. Maybe make a specific goal of I'm going to exercise Monday, Wednesday, Friday, and walk a half a mile this week. That's more specific. Normalize your eating patterns, being aware of your portion sizes, slow down your eating. A lot of us we eat on the go, we eat very quickly, we don't even taste really what we eat. So slowing down that process and enjoying it will also help. Let your hunger and satiety guide your eating. So with that, by slowing it down, it allows your brain time to say, hey, I'm full, versus woofing it all down, and then your brain catches up and says, oh my gosh, I feel like I could puke, I'm so full. So eating regularly and frequently, that whole stoking the fire, right? So you're burning calories. So small, frequent meals of high quality, nutrient-dense foods are going to help you. Focusing on long-term lifestyle changes, adapting or adopting active lifestyles, those are all things that are going to help in the long run to help you reach your goals and maintain them. So some principles that are good to keep in mind of behavior change are setting those positive, realistic, achievable goals, being specific, monitoring how your behavior has changed, so it helps assess your success of the goal, and modify your environment to support the change. So having a support system, having rewards, so maybe if you've hit your goal of that you've lost 1 or 2 pounds that first week, maybe allow yourself a small indulgent pleasure. And you're going to see a lot of similarities with how these goals are set, because this is the nursing process. So when you get into Nursing 126 next semester, you will be setting nursing care plans and identifying problems and setting goals and evaluating those. And this is what basically that is nursing process in action. And so here is, like I just mentioned, this is the nursing process. We assess a problem. We identify, we diagnose what our nursing diagnosis is, right? We plan how we're going to fix it. We implement the plan, and we evaluate how it worked. So long nursing recommendations for weight loss is by increasing that duration and intensity. So you start out slow and then you increase it as you become more physically fit. Regular exercise will help preserve that lean body mass and increase that resting energy expenditure. Safe, permanent weight loss involving physical activity, and setting that goal, that loss of a healthy 1 to 2 pounds a week tends to be the most effective way of keeping weight off the long term. Instead of doing those fad diets and maybe you lose 6 pounds in 1 week, sure, you feel great when you get on the scale, but the chances are that weight's going to creep back up. Now, we all have our own body image and attitudes regarding our health and our physical appearance. So the way that we think will change our health. So if you have a pessimistic or negative self-efficacy about yourself or self-image, then you tend to believe that nothing's going to change, that you judge your own body very negative in appearance, and it won't attempt to improve your body related to the fact that it's unchangeable. So you just feel like, what's the point? I can't change anything, so why even bother? So a positive attitude will actually help that weight loss process. So you accept kind of how you are, you engage in behaviors that improve your health, and then as you see those improvements, you tend to become more optimistic. So we talk about that whole mind, body, and spirit, and this is a perfect example of that. If I can't remember how that saying goes, if I think I can, I will. If I think I can't, I won't, I think is what I've heard said before. So that really does have a lot to come into play. Now, there's also eating disorders that go out there. So we talk about binge eating and bulimia nervosa, and you've probably heard of these, along with anorexia, which we're going to talk about. So what happens with a binge eating disorder is you have these episodes of eating like rapid, large amounts of food, and it's usually done secretively. So a lot of times maybe they'll have a secret stash, or they eat when someone's not home, so they're not judging them, and they eat just tons. And then they have a lot of guilt and shame as a result of it. It's generally triggered by things like stressful events in their life. And people who are like chronic dieters, you've probably all known these people who are chronically either fasting or doing these things, and then what they'll do is they go in and they binge, and then they feel bad about themselves as a result. Now, with bulimia, food is actually a coping mechanism. So they do the binge eating, and then followed by that, because of the guilt, they have compensating behaviors, which are things like vomiting. So they do self-induced vomiting. Laxatives to help cleanse the colon and get rid of all that extra calories through that. They exercise fanatically. They will fast after the binging episodes. They take diuretics to get rid of the water weight, and with that comes electrolyte imbalances along with the vomiting and laxatives, so they can have a lot of other problems. And then you look at anorexia, and anorexia is out there, right? These patients severely reject food, and it causes extreme weight loss. They have a very low BMR, and they're very exhausted, right? And it's caused by often unresolved emotional issues. They have perfectionist behaviors. They may be introverted in their behaviors as well. They may be overly dependent on people or socially insecure about themselves. And so typically anorexia is a result of some unresolved emotional issue. Now, some signs that would alert you to a person who is anorexic would be maybe that pursuit, that relentless pursuit of thinness. They're fearful of fat. Like, I can't eat that. I'm going to be fat. I don't want to be fat. They have this distorted body image. So how they perceive themselves extremely differs from what the reality of what other people see. And I think a good example is that picture in that lower right-hand corner. Well, clearly, most of us, I would think, looking at that picture would go, oh my gosh, that person is anorexic, they are malnourished, they are not healthy. But that person's own perception of their self is that they're fat and disgusting. So because they don't have any nourishment, because they are consuming way less calories than what they need, the women will tend to have amenorrhea or absence of menstrual cycles. Their bone density is decreased. They have higher risk of fractures. They are anemic. They may have very low blood pressure as well. And I think here is a couple good pictures. So here reflects that whole self-perception. Clearly you can see hip bones, you can see vertebrae. My gosh, you can count the vertebrae here, the scapula. But then her perception is much different than that. And then here you've got your binge eating. They're secretly eating everything in sight, and then with the bulimia, then they feel guilty and they will purge. So how do we treat anorexia nervosa and bulimia or binge eating? We need to be accepting of the behaviors, non-judgmental, recognize that they do have a high risk of death. They have a priority is intake. So a lot of times there are very specialized clinics for eating disorders, and they are very structured and very rigid. If these patients are not taking in the appropriate amount of calories, they will put a feeding tube in, and that's what I mean by the enteral feeding. We help them with food acceptance. A lot of people who have anorexia and eating disorders, they view food as disgusting. So we need to help get them to a point where food is okay and food is nourishing and making healthy choices. It really requires a multidisciplinary team approach. So you're going to have physicians and nurses and therapists and dietitians and physical therapy, occupational therapy because of the weakness. You're going to have psychologists or psychiatrists that are going to help them with that emotional aspect of that. Okay, so your priority is that emotional control, learning to control those responses. Doing some alternative things like helping them with food choices, helping them maybe with meditation to help when they start having those overwhelming feelings. So it really is a long process for a lot of these patients, and very, very specialized clinics as a result. Now, I also have this kind of a little funny take on overweight, but there is a video out there by, it's a Lady Gaga, Baby Fat, and I think it's a good one just to kind of to watch and get a little humor, I guess, out of all of this. So if you have any questions, please feel free to email me regarding the content, and refer, as always, to your book and the videos that I have posted in the learning module to help facilitate your learning.